We basically have two main priorities in the Kyrgyz Republic. The first is emergency preparedness in support of the authorities, whether it is in the health field, through specialized medical training, emergency room trauma courses addressed to different audiences, support to selected health structures, health centers, and including rehabilitation of health centers and operating theaters in some hospitals. Support to selected water boards, also in order to enable them to better be able to cope with certain situations in case of need. And of course we work with the national society together, especially in the domain of first aid, re-establishing of family links, and generally supporting the emergency preparedness and response program. That's the first big, if you want, the first big block of priorities. And the second one is very much continuing activities from previous years, mainly in the domain of detention. Our biggest program is the support to the authorities in the fight against tuberculosis in the penitentiary system. We will continue the big construction works actually in one penitentiary colony, which is supposed to be a centralized treatment facility for tuberculosis in the penitentiary sector. This is a very large construction project which has been ongoing for a while, which we hope to concentrate on finishing the main building for multi-drug resistant patient TB patients this year. So this is one big project that we're hoping to accomplish, and we're hoping to advance with construction work in one penitentiary facility in the south of the country, in order also to support the authorities to avoid problems of overcrowding in other locations. We're also still following up with families who have family members gone missing in the aftermath of the June 2010 events. This is equally ongoing, so we continue detention visits, we continue the big tuberculosis program, and we continue liaising with the authorities and with the families of missing. And again, of course, we continue to liaise with the national society, including on their general programs directed towards implementation, dissemination of international humanitarian law, etc. So